Hello, everyone. My name is Dr. Steve Lee. I'm with the Department of Otolaryngology Head and Neck Surgery, commonly known as ear, nose, and throat. And you would think that in our specialty that lifestyle medicine wouldn't play a big part, but in fact, a lot of the things that we deal with in ENT are due to lifestyle choices that people make. In my subspecialty, which is head and neck oncology, obviously the tumors are driven much by smoking and drinking, which are lifestyle factors. But in other things, systemic diseases that are common throughout the population, like obesity and diabetes, especially, drive a lot of the pathology that we see in ENT. For example, one of the things that I deal with is sleep apnea. There's surgeries that we can do for sleep apnea, but sleep apnea is mostly driven by obesity, and obesity is mostly driven by lifestyle choices. And most of the surgeries that we perform are not effective in people that have BMIs greater than 30 to 35. So most of the patients that come to me are obese and looking for surgical options to get away from CPAP use. But I have to unfortunately tell them that they have to lose weight to get to a BMI of about 30 before any surgical interventions are very effective. And at that point, I have to give them some counseling on diet to be more effective in weight loss and things like that. And then seemingly unrelated things like allergic rhinitis can also be driven by kind of pro-inflammatory state in our bodies, which is also driven by diet and exercise and carrying excess adipose tissue. So, we give them the Flonase and histamine blockers and like nasal rinses to try to treat their allergic rhinitis pharmacologically. But once those are exhausted, I often tell people that lifestyle choices and the foods they eat can be shown to better treat their allergic rhinitis. And there's several studies on the Mediterranean diet just being one of the diets that are more commonly studied being useful in allergic rhinitis. And the thing that I think is the most useful is that diabetes has a lot of consequences in the ENT world. And I'll give you a couple examples. One is I had a patient, I also work at the VA, which is more of a general practice ENT clinic. And he was a gentleman with fairly poorly controlled diabetes. And he would have skin abscesses that came up about once a month. And we would have to do incision and drainage about once a month. And after about 6 months of this, I told him, we can just drain your abscesses monthly for the rest of your life, or you can treat the root cause of the problem. And he asked me, what's the root cause of the problem? And it's diabetes. And he said, well, I'm taking my metformin, just like my doctor is telling me to, and the glipizide, and I'm taking the medicines as directed. And I said, well, has your doctor ever told you that diabetes is mostly a dietary, type 2 diabetes is mostly a dietary driven disease? And he said, no one's ever told me that. And I told him, and this is the thing that I tell most of my patients, is to eat a diet that is mostly vegetables, drink only water, eat a lot of beans. There's several studies that show that beans are just as effective as glipizide in prospective trials. I think it was a study done out of in some Nordic country. And so I suggested that to him, and I suggest this kind of diet to almost all my diabetic patients that have ENT consequences of their diabetic disease. And most people don't follow them. And I'd say I've told this advice to hundreds of people, and probably a small handful follow the advice. And he happened to be one of the few guys that actually followed my advice. I saw him several months later. He did not show up to my clinic anymore. We did not lance any abscesses. He came back to the ENT clinic about 6 months later just to come by and thank me for telling him about that. His skin looked amazingly better. He obviously did not have any abscesses that we need to drain, and he was completely off of all his diabetic meds, off glipizide, off metformin. He had lost about 40 pounds, and he actually got off the gabapentin that he was on, um, as well, for his diabetic neuropathy in his foot. And what was one of the ways that he was able to follow diet is he told me that he was a cook in the Navy, and that was his job when he was in the military. And so he really got into the whole plant-based diet, and he researched it, found lots of recipes, really had a lot of fun cooking the food, and was very into it. And he just loved that he felt better, he had more energy, he's off his meds, and his, the other things like his blood pressure, they all got better as a consequence of his dietary changes. So he was a great success story. And another funny story that I tell my residents is there was once a time that an undiagnosed type 2 diabetic Hispanic gentleman who was about, I think he was in his 60s, he came into the hospital when I was on call for something called mucormycosis, or invasive fungal sinusitis. This is basically sinusitis that you get from a fungal infection that is uncontrolled. It rapidly progresses, causes rapid necrosis of the sinus cavity, requires resection. This gentleman, we had to take out his entire right maxilla, and almost had to take out his eye. It progresses pretty rapidly, and if you don't control it within a few days, it can be rapidly fatal. Generally, mucormycosis has up to a 50% fatality rate. Anyways, he was an undiagnosed type 2 diabetic, had blood sugars close to 300 on diagnosis. We emergently took him to the operating room, debrided the dead tissue, and then asked medicine to help us with his diabetic management. He was on an insulin drip and the ADA diet. And I think it's funny that, I noticed when I walked into his room, the ADA diet was like some sugar-free Jello and like apple juice and like toast. It was kind of a ridiculous diet, I thought, but that was the ADA diet that the hospital was giving this patient. So I told my residents, hey, this is our patient, right? We can order whatever we want, and as a diet. And they said, yeah, we just put him on the diabetic diet. And I said, well, write a diet order, because even on an insulin drip, they could not, his blood sugars would swing widely, and they would have to adjust the insulin drip all the time. So I told them that he should get a diet that is beans, boiled beans, steamed vegetables, and water only. And I remember the hospital dietitian wrote me a fairly strongly worded note saying that this was not an adequate diet, not a complete diet, and was not nutritionally complete, and she could not recommend it. But I told my team to just ignore that. We're not asking him to be on this for the rest of his life. We just need it on him for a couple of days to a week while we get his diabetes under control. And try to fight off his mucormycosis, because you have to fix the immunocompromised state from diabetes. Usually it's diabetic patients, or sometimes it is cancer patients on chemotherapy, or transplant patients that get this mucormycosis. But once you fix the underlying immunodeficiency, the fungal disease can be fairly rapidly controlled. So anyway, we put him on a diet. The next day, his blood sugars normalized, and they were very steady. He did not need his insulin drip anymore, and he survived his mucormycosis. So a simple dietary change was much more effective than an insulin drip in that case. So anyways, I think that there is a big role for lifestyle medicine in any subspecialty, because many of the systemic diseases that are common in the population, like diabetes, like obesity, cause lots of problems in almost any specialty that you pick. Okay, so thanks for listening to my stories, and I hope you enjoy the rest of your presentation.